I'm Marie Harvey, and I'm the Associate Dean for Research in the College of Public Health and Human Sciences. And like I said, I'm just delighted to see that you're coming to join the seminar today. This is our first seminar for the winter 2022 term. And I'm also very pleased to introduce Dr. Victor Boberg, who is a professor of epidemiology in the College of Public Health and Human Sciences. And he has graciously agreed to moderate this seminar and introduce our speaker. And he's also going to do a little bit more telling you some instructions for this webinar Zoom presentation. So no further ado, Victor, I'm going to hand it over to you.
Well, thanks, Marie. As Marie said, we'll do a little bit of housekeeping while folks are joining in. So welcome to the Friday Research Seminar. We're very glad you're here to join us. Today is a Zoom presentation. And so as we do with Zooms, we are using a webinar approach, which means your microphones are muted. So if you want to ask a question in Zoom, please use the Q&A feature. We'll be moderating that and reading questions out loud so that our presenter can hear them. We're going to collect questions as the session goes on and then discuss them all at the end. So without further ado, we're very honored to welcome Chancellor Corinne Peek-Asa to present Interdisciplinary Research Can Reduce Motor Vehicle Crashes Among Novice Drivers. All of us were once novice drivers, and some of us have novice drivers at home. So a topic near and dear probably to most of us. Chancellor Peek-Asa is 21 days into her tenure as the UC San Diego Vice Chancellor for Research. So congratulations on that appointment. Prior to UCSD, she was appointed at the University of Iowa in the College of Public Health there as the Battershell Distinguished Professor and the Associate Dean for Research, and directed the Injury Prevention Research Center there. Wide-ranging career spanning almost every topic you can imagine in injury. Lots of notable achievements, including helping to found injury and violence research in 11 locations around the world, and including 8 trauma registries to conduct injury surveillance in those countries. She's had extensive service to both the National Institute for Occupational Safety and Health and the National Academy of Sciences, and was most recently elected to the National Academy of Medicine. So without further ado, welcome Chancellor Peek-Asa, and we're looking forward to your talk. Thanks for coming today.
Great, thank you. Well, I first want to say what a pleasure it is to be here. Marie and I served as on committees in the Associated Schools of Public Health for many years, so it's really nice when we get to interact outside of that as well. So I will share my screen and get started. Today our challenge, if I can get the slides to, there we go, is to think about how interdisciplinary science can help us improve novice driving. And I will note that this work was all done starting when I was at UCLA in the Department of Epidemiology prior to Iowa, and then when I was then moved to Iowa. And certainly moving from Associate Dean for Research in the School of Public Health to being the Vice Chancellor for Research over a very large university's research enterprise, I've been giving a lot of thought to interdisciplinary science and what are structures that support it. Why is it better for answering questions, and how do we embed interdisciplinary education, research, and engagement into just how we do the work we do at the university? But today we're going to focus on novice driving. So first, we probably need to establish just what the challenges are with novice driving. So novice drivers across the world, regardless of when licensing begins, in some countries, there are very loose restrictions on licensing, so you can kind of begin driving whenever you can get a car. In other places, it's very regulated, and sometimes they don't even start licensing until age 18. But regardless of what the policies are, new drivers have an experience gap that creates burden on the road. We in the US have state licensing laws that can begin as young as 14 and a half or start in some way, usually at about 15 and a half or 16. And so there are also, in addition to the experience issues, some developmental issues that create some gaps and risk as well. So we're going to talk a little bit about how we learned that was the case. But I first want to point out that we've recognized for a long time that driving is a task that requires experience and training. This is one of my favorite pictures because we also do a lot of simulated work to understand how people interact with roadways and vehicle design. It's sort of that human factors of the built environment of transportation. And so all the way back to 1955, when students at what was then called the Iowa State Teachers College, it's now the Northern Iowa University, learned driving fundamentals in one of the very first simulated environments for driving called the Drivo-Trainer. So you can imagine that's a lot more fun than what we kind of do now for driver's training, which is a lot of sitting in a dark room, watching gory movies, and then maybe having some driving experience that has various levels of fun and engagement to it. When we look at data, and of course, as an epidemiologist, I always want to start with what does the data tell us? We see that the highest crash involvement of all drivers is during the first 6 months of driving. And it's really quite a striking trend. And so this graph here is some work that has been repeated, but we've known this for a long time, sort of this really high peak that goes down. And we do see there's a kind of a myth out there that older drivers are the worst scary drivers, but really they're, although there is somewhat of a crash involvement increase, it's actually pretty slight. And really what we see with older drivers is the sort of age-related challenges to personal body resilience are what causes the injuries in older drivers. So lower speed crashes tend to cause higher level injuries. Being in Iowa, we were very interested in rural driving because the rural driving environment poses a number of additional challenges like gravel roads, uncontrolled intersections, narrow roads with no shoulders. So we were interested in looking at that disparity. And so the graph on the right is showing this same sort of graph of fatal crash involvement, which is a combination of crash involvement. Given crash involvement, was there an injury? And given injury, did that lead to a fatality? So there are a number of steps of things that have to happen before you actually die in a motor vehicle crash. And all three of those steps were elevated in younger compared to older drivers, and quite substantially so among all ages in rural compared to urban environments, but most particularly in younger drivers. And so another epidemiology nerdy thing, this phenomenon is really only visible when you use the right denominators. So the highest crash volume is not on rural roads, but the highest crash rate per mile driven is. So it's really important, and a good thing we have sort of evolving access to all kinds of data that we can see comparisons that are hard to tease out when we can only get a population, or we can get a good count of an event, but we can't get a good exposure denominator for that. So why are teens such bad drivers? So one is the experience, and we can overcome that. We know how to create experience in safe environments, but the piece that we really only started to get was when neuroscience started helping us understand a lot more about brain development and what that actually meant for how we interact in our lived environment. It's for driving, two of the most important brain systems are the limbic system, that's the emotional center. And we kind of think in theory driving isn't emotional, but when we look at road rage, when we think about sometimes the stresses that we're under when we're trying to get from one place to another, the life stresses that maybe in a quiet moment of the car come out, maybe the people in the car with us are creating a lot of stress. So recognizing that there is a neurophysiologic response of the brain that impacts the driving environment is important. And then the most important part is the frontal lobe, because so many really fast judgments, so much environmental processing has to happen to drive safely in your environment that you need to be making anticipatory choices again and again and again, and continuously as you're driving. And that's a complicated frontal lobe process. And so the challenge in the teenage brain is that these systems are not completely developed yet until maybe the early 20s, and they're not completely connected until age 22 or 23. So I just want to point out that this is well recognized, and the World Health Organization, based on these data, now don't actually even count the period of adulthood until starting the age of 23. So when we're putting 15-year-olds in a car, there is a bit of a lack of maturation. It's not that there's anything wrong with the teen. Teens are really smart and they have very good reaction time, but the reality is the neurodevelopmental trajectories are not fully complete in the limbic system or the frontal lobe at these times. And so the limbic system is the teen sitting in the car with all the neurotransmitter floods that happen during puberty and afterwards, where with the constant, things going on in the mind, they hate me, they're talking about me, I wasn't invited, rumors, all this social stuff, that if those are triggered at the time, they just are a very dominant piece of the brain. And then in the frontal lobe, it's not usually the teen's favorite part of their brain. That's math, reading, parent rules, etc. So this is the blah, blah, blah part of teens. And it's even more pronounced because the very last piece of brain maturation is the connection of the neurotransmitters between the limbic system and the frontal lobe. So there's kind of this leap and stop way that the brain develops, that there's a big surge of development of one area. It can be the brainstem, it can be any part of the brain. And then after that surge of activity, there's more connective activity of how that new function and those neurotransmitters are connected to other pieces in the brain. So realistically, what happens in the car is that the teen's driving along, they get a text, they think about their boyfriend dumping them, whatever it is, but they get this flood of neurotransmitters in their brain that dominates brain activity. And the frontal lobe is not connected to the limbic system enough to say, hey, take a step back. We're driving right now. You're about to make a left-hand turn, or you're following too closely, and we need to put away the limbic system so I can make a choice about how to negotiate this environmental cue. So with those examples, we'll talk about approaches that have been used and where we have some gaps to fill. So the basic tenets of increasing safe teen driving have been limited risky driving exposures during the learning phase. And these are well established in many ways. It includes driver's education, which I think we have opportunities to really improve driver's education thinking about the teenage brain. But more prominently are graduated driver's licensing laws that restrict driving late at night. Sometimes it restricts routes. Sometimes they require a certain number of supervised driving hours. Sometimes they restrict the number of teens in the car. There's a good evidence base for what the strongest policies are and the periods that those should be in place. Not every state follows every piece, but most states do have some sort of graduated drivers phasing into driving. It's also important to ensure driving proficiency. So having enough supervised hours in an unrisky driving setting that you've mastered the task of driving the car. It doesn't solve the problem of the neurodevelopmental challenges to driving. And so motivating teens to prioritize driving safety is a really important piece. And that's a part that is not as fully developed or as advanced as the driving exposure or requirements for driving practice. So it's been recognized that parents are a really important part of learning to drive. So some of the parent-focused interventions include parent contracts with teens. There's a well-established program called Checkpoints where parents and teens kind of agree to mostly things around driving rules. And I'm going to get back to that in just a second. Some driver's education programs and some states by policy require that there's a parent component to driver's education. And that's probably really helpful, but its impact is going to depend on the quality of the programming in both the teen and the parent component. There are in-vehicle feedback systems that create data like what I just showed you that involve parents. We've studied those and we'll talk about that later in the presentation. But generally the teen's car is equipped with in-vehicle feedback. The teen gets a notice when they've done something wrong in the car, and then the parent gets a report card about what happened. There are now phone apps that have this kind of, all kinds of different parent tracking tools that could be more geospatial, where is the teen, but some of them that also track things like speed, or that track these kinds of G-force events, sudden acceleration or braking or lateral movement, and sort of counts them. In the phone apps, there's not as much depth about telling what actually happened. So that would then maybe initiate a conversation from the parent to the teen about what's going on in these events. programs that assist parents with supervised driving. More of these are coming out because it turns out parents don't really know, and there's not really good sources of information about how to teach someone else to drive. They kind of know how to do it. They learned maybe from a good driver, maybe not a good driver, but that's a challenge to really help. What do you talk about? What do you teach? How do you teach it? And then the last piece is what we recognized several years ago was one of the biggest gaps, which are parent communication interventions. So we'll talk for just a second about parent-teen communication about driving. So first of all, we did some research working with communication experts and some health behavior specialists in public health to understand where do teens' perceptions of driving come, especially related to their parents. And there's a big disconnect between what the parent thinks they've said and what the teen reports hearing and how that impacts teens' perceptions on safe driving. And in a nutshell, it turns out it doesn't matter what the parent thinks they said. It really doesn't. That was completely independent of the teen's perception on driving. What mattered was what the teen heard. So if the teen reports hearing from the parent that it's a topic of importance, even if the communication wasn't necessarily successful, it had an impact on teens' driving perception. And so one challenge that we felt we needed to fill is influencing safe driving in a developmentally appropriate manner. So one of the challenges is sort of what is the role of the parent and how do we deliver and empower teens to drive in a safe way, recognizing that driving is a big rite of passage, that parents, it creates convenience in the household because parents don't have to drive teens around. It's really a passing over from the parent to the teen of some autonomy and trust. But at the same time, communication studies found that conversations about driving were among the most fraught reported by parents and teens, even more so than talking about sex or talking about drugs or talking about grades. The highest conflict was reported in talking about learning to drive. And when we think developmentally about the teen brain, it kind of makes sense. And it's kind of a perfect storm. So most of the conversations that parents were actually having about driving were about when the teen could have the car, when they had to be home, how they had to drive, who could be in the car. So some things that were somewhat safety related, but it was all about rules. And in sort of the mid to late teen stage, when the frontal lobe is taking on a bit stronger role, one of the jobs of the brain of neurodevelopment is to find autonomy and to figure out where you are in your social order and what kind of presence do you want to have. So it's your goal to kind of push back. One of the things to learn that is pushing back against rules. So parents, learn to realize that one of the teens' jobs is to push back on rules. So if everything about driving is a rule and a restriction, and then the teen gets in the car and okay, well, it's a rule to wear my seatbelt. It's a rule to be home at midnight. I know my parents are going to notice if I'm not home at midnight, but they're not going to know if I don't wear my seatbelt. So it sets up kind of a perfect storm of having the safety behaviors be the pushback. It's the way that the parent, it's a place where the parent can't really, when you get into unsupervised driving, control that environment. So recognizing that communication about driving is critical, that the nature of rules and regulations are things that teens are going to naturally resist. It then opens the door to find ways to have objective visual feedback in a way that parents' communication is empowering teens to make their own choice to be a safe driver. So getting to that recognition of thinking there's a gap there in the intervention environment, we developed a program called Steering Teens Safe. And here we went to sort of the areas where we learned some of these tenets, so experts in communication, in cognitive psychology, and intervention development. And so Steering Teens Safe is not meant to be everything you need to teach a teen to be a safe driver. It doesn't address the experience piece, and it doesn't really address the rules. When do you have to be home? When can you use the car? It's solely meant to increase the parental role in teaching teens about driving skills and driving safety and improving communication about driving safety between parents and teens, specifically to motivate the teen to choose safe driving on their own. So that part of the autonomy and trust of taking over as a driver is the teen self-motivating to be and take seriously the task of driving. So the program itself has two components. One is the communication strategy and the other is the safety topics. And so we looked at crash data, we looked at citation data for teen drivers. We talked to driver's ed instructors and Department of Transportation experts and dove deep into the transportation world to figure out what are the main topics in safety. So it's not how do you work the windshield wipers or how does power steering work. It's really focused on safety behaviors. And so we came up with 5 topics and 24 lessons that addressed things like safe driver behavior. We included safe passenger behavior, recognizing that when a teen is driving, it's their job for everyone in the car to wear their seatbelt, to not distract the driver, to be attentive to the driving environment. And that teen also needs to contribute to a safe environment when they're a passenger in someone else's car. So that it's really kind of everyone's responsibility. And we got that from looking at some of the driving videos where all the teens in the car, except the driver, were on their phones. And it almost looked like, you could see they were like, everyone's on their phone and what am I missing? So all of a sudden they would pick up their phone and then there would be an event that triggered the recording. Okay, so also general driving skills, which include things like following too close, turning maneuvers, things that speeding, distracted driving, things that behaviors that contribute to crashes. We included driving skills for rural roads because it turns out there's not a lot of even driving programs that teach rural road driving, despite the fact that they're the highest crash rates per mile traveled. And then finally, we did have a piece on driving rules and expectations, trying to improve communication between parents and teens so it doesn't sound so autocratic in what's happening. So another really important piece of the intervention is that we taught parents skills from motivational interviewing, which is becoming largely because of public health presence, a very common skill taught for many types of behavior change. So it's used in addiction treatment. It's used in clinics quite a bit, especially when there's a diagnosis with a new chronic disease that needs some behavior change. So it's a health behavior technique that focuses on whoever the conversation is with, motivating that person, be it the patient, the client, the teen, to choose the new behavioral strategy on their own. So finding their own internal motivations. And so we thought it was a really good skill to teach parents because that conflict so much comes from the parent telling the teen what to do and the teen not wanting to be told what to do. So motivational interviewing takes off telling someone what to do altogether. So it's really focused on active listening, self-exploration, using things like open-ended questions, affirmations, reflections, and summaries. So I'm going to show, we had a number of videos that demonstrated these conversations, and I'll show you one of the many that are on the website. Okay, so that was the end of the video. So we were able to do a clinical trial testing the communication strategy, and we asked parents and teens sort of what their parents talked about. And we had a control intervention where the parents got the Steering Teens Safe program or an intervention, and then the controls got nothing. So one other thing I want to point out is in epidemiology, when I, 30 years ago, not quite that long, when I was in epidemiology, I didn't have a single course that talked about community engaged interventions. There were drug trials that I learned about, but I will say it's my main interest. So I've really focused a lot on trying to bolster the different types of observational designs we can use, the different types of trial designs. Whoops. And I've really enjoyed it. And so I really encourage anyone who has that interest to focus as much on prediction modeling as also include a focus on intervention evaluation. So when we looked at comparisons between interventions and intervention and control families, and this is what the team reported, because we had learned that it doesn't matter what the parent says, it only matters what the team hears. So based on what the teens said, we saw a much higher proportion of intervention teens reporting they talked to their parents about things compared to the controls. And we saw some of the greatest increases among the topics that were least commonly addressed, which include things like some of the rural roadway features, which parents told us we just didn't even think to tell our students about, our teens about. So we also, one thing I also really like about a lot of the evaluation methodology is that it tends to be mixed methods. So there's some qualitative, some quantitative. And again, in that sort of spirit of interdisciplinary research, I know enough about qualitative research to be a really good partner. I don't know enough to do it on my own. And sort of being at that sweet spot that I can talk intelligently about it and really respect what the qualitative experts are bringing to the team makes it just a really fun environment to work in. So some of the things that we heard parents say, they did really like the motivational interviewing tactics and how specific we were about how to start a question using an MI rather than an autocratic kind of approach. So they said things like, it makes you stop and think instead of screaming, helped calm the parent down, and sometimes the parent would catch themselves. My kids, I did this before they started driving, and I used the MI tools in everything, and they got really attuned to it and would say, "Mom, stop MIing me. I'm gonna wear my seatbelt." So we also had a self-report risky driving inventory, and intervention teens reported 21% reductions in self-reported risky driving. And that was a significant difference. I don't have the confidence intervals around it. We'll get some nice modeling estimates later on. And then among parents who scored above the mean in talking success, so parents who did better with the intervention had an even higher, 32% decrease in risky driving. So these were promising results. So the next step integrated sort of our engineering friends who at that time were doing a lot of the instrumented vehicle interventions. So one of the challenges and gaps in interventions with the in-vehicle feedback systems is that parents would look at the report card and then fight with their teen about it. The most common reason that teens would ask for the system to be taken out of their car was because their parents were yelling at them about it. So we thought there was an opportunity to use this steering teen safe approach to teach parents communication strategies so that they could better use the information from the in-vehicle video system. So we had 3 groups and we enrolled 80 teens in each group. And so we had one group that was pretty much the control. So we implemented the system so we could measure the driving errors, but there was no feedback. So feedback is given either by a blinking light on the equipment that indicates when recording is happening, so they know an event has happened. And then feedback also comes from the parents receiving a report card that has clips of the videos that were recorded and a report card of how the teen was doing. And then the third group had the equipment feedback, but also the parent received steering teen safe training. So here's a quick snippet of what the report card looked like. And we, again, talked with cognitive psychologists about what kind of information would be helpful. And so one is looking over time, but the other was using some norming behavior. So teens who were doing well and well relative to their peers knew that and could feel good about it, and the parent could laud that, but also kind of put them in the context of where they were, because peer comparisons are also just part of the developing brain. So here is a slide that shows the impact of that intervention. So here what we have is the effect of the intervention on driving error rates per 1,000 mile driven. So the equipment has a fleet service element which collects mileage and location, so we could look at routes. And then we could collect every driving error and code it. Sometimes if you go over a big speed bump too fast, it'll trigger the camera, so we could take out things that were not actually driving errors. And so what we found, with no feedback being the null condition, is that there was a significant decrease in driving error, the driving error rate, when the teen only got feedback from the system and the parent got the report card. And that was even higher, a more protective effect when the parent also got steering teens safe. So this is this is good. These were good results. We were really happy to see these, but we were even more happy to just compare the two intervention groups and see that there was still a significant protective effect of the parents who got steering teens safe compared to the feedback group. So a significant increase in protective effect by adding steering teens safe that is independent of the null control group. So this sort of led to, okay, we have some strategies. It wasn't just steering teens safe, but some of the phone apps and the in-vehicle equipment and the policies that implement phased phased risk driving, the graduated driver's licensing systems. And then we kind of were at a point of asking, in the bigger field of novice driver safety, what if these are really sustainable? In-vehicle video equipment is not really sustainable. And it's one of those challenges we have in public health, that it is going to be the most accessible to the highest resource and potentially new drivers that need it the least. Because often it was the more expensive insurance programs that offered it. So the way it was available was not equitable. And it's also fairly invasive. Probably, I mean, a good 20% of the teens in our studies didn't trigger the camera ever. So not every teen needs it. So how do we think about sustainability? How do we think about scale? And how do we sort of differentiate, what does everybody need? What are the tools every single driver needs to be safe on the road when they're learning? And what do we need specifically for high-risk audiences? And so that's kind of where we're focusing now. What do high-risk audiences need? And then we realized there is actually not a good tool or screener to tell who is going to be a high-risk driver. Well, I'll get to that in a minute. So before that, we're thinking, okay, how can we make the teaching of novice driving to parents sustainable? What kinds of models fit? And here we engaged our workplace wellness and occupational health experts who were very focused on how do we integrate wellness, overall wellness, into businesses. And so we did a translation study translating steering teens safe into a workplace wellness program. And so we got the grant, and then we were sort of terrified that the companies who would write us the sort of initial letter you get wouldn't actually participate. But it turns out that not only did our original companies participate, but then a couple others wanted to join in as well, because the companies that are really embracing the kind of wellness concept and the sort of integrating worker wellness with occupational health and safety want programming, and they want to address things that either high insurance costs, and a lot of motor vehicle crashes in a business are going to create insurance costs, or that their workforce is interested in. And a lot of the working age workforce in the US has teenagers who drive. So we had an insurance company, a testing company, it was the ACT company, and then a couple healthcare companies let us embed steering teens safe into their workplace wellness programs. So it was implemented as part of a lunch and learn program by a trained wellness coordinator, and parents learned about the program and communication techniques, and then they had a self-guided website and had follow-up lunch and learns to kind of practice and report in. So again, we did some survey measurements, some qualitative data, and we found that parent-teen conversations, and here this is just reported by the parent because we didn't include any teen measures. But the parent reported that the number of conversations and the quality of those conversations increased. And we also just saw a lot of engagement by the parents, that not all of them finished the whole program, but most of them engaged in a good part of it. So that was promising. It is hard to measure this kind of translation. We need better measuring tools, and we need better modeling tools for our work in translational research. And so then our next step that we're working on now, and this is a project led by a former student of mine or colleague of mine who is now at Nationwide Children's Hospital and The Ohio State University, is thinking about how do we work on high-risk audiences. And the group we decided to focus on are teens who have received a moving violation. So we are guessing it's probably not the most sensitive tool, but it's probably pretty specific that if a teen is giving a citation for speeding, reckless driving, some sort of moving error, there's a good chance that they are at high risk. And it's also a learning moment. So we now have a study where we're working with state court systems. The courts are great partners. They're, you have to work exactly in the parameters they can let you. But we were actually really pleasantly surprised to see that traffic court judges were champions for programming that actually helped improve driving rather than just find the families and leave them with no tools. So we recruit into either a control group or an intervention group where there is some in-vehicle feedback and steering teens safe. And so we had hoped to be wrapping up this study now, but COVID kind of shut down the court system for a while and has really stymied our ability to recruit. So we're only about halfway done, but we hope to get there and then sort of think about how do we create this as a sustainable model, tools that are just passively available that maintain some fidelity so that parents have some tools to use after their teen has been cited. So that is the end of the presentation, but I would be more than happy to answer questions, and good, I left a little bit of time to do that.
But Chancellor Peek-Asa, thanks so much for a wonderful tour through these projects. And I think it's fantastic that you walked us all the way from observational studies to interventions, because like you, I trained in an era where epidemiologists learned about clinical trials, and that was pretty much it. And if you wanted to go actually do something, you had to go further than that. So while folks are, please put your questions in the Q&A, and as they pop in, I will read them and we'll discuss them from there. I had a quick question based on just your last the drive project there, and yeah, I know in other settings it's sometimes a challenge when you take a program that was once kind of voluntary and say, as a condition of getting a ticket, you will now have to go do this. Have you got any kind of anecdotal feedback yet about folks who are getting this through traffic court, and how is it received?
We were worried about that as well. And we were worried that parents would just not want to be bothered, and that teens also would feel like, okay, this is being stuffed down my throat. But it turns out it's kind of a moment, and there's no extra benefit. So, I mean, it would be great if you didn't have to pay, if you did the program and passed elements of the program, you didn't have to pay your fine. There's no benefit in that, although there is compensation for participating. But it turns out it is a moment where you're like, okay, this could have been a crash, and the parent and the teen is thinking, okay, I don't want more rules, so if I can do this instead, let's do it. So we are lower than recruitment success in sort of the open, but we're still at almost 80%. Wow. And we have not had any of our court, it's really rare for teens or parents to withdraw from the study and ask to have the equipment pulled out. And in the court series, we haven't had any, but we have had control parents who knew, two instances where the control parent knew the intervention parent said, well, I want that. And so we now have, and I think this should be a more standard protocol, that if we are able to show some effectiveness, we can make this available to the control group at the end.
That's good when you have the people in the control group demanding the treatment arm, right?
But let me answer another part of that question that is just on my mind, especially as we are trying so hard to be better at equity, diversity, and inclusion, which is that it is really hard to enroll a diverse sample in studies like this. And the resource disparity is the biggest issue, because we kind of require that a teen have primary access to a car, because it's hard to, when you have 5 people driving a car and you're recording all of them, it just gets really difficult to set up the protocol. So it's just heavy on my mind that I think about so many of these kind of community-based trials. And some researchers are doing a great job of engaging the right kinds of pathways and partners to do really equitable enrollment. But it's a challenge on many levels that we just need to do better with. And the worry there then also is that our interventions, when you try to get them out and scale them up, become very inequitable. So as evidence increased, primarily from looking at fleet vehicles, that these in-vehicle feedback systems are really effective, they only became available through insurance companies that had used them who also insure fleets. And those are, companies that are not the most accessible insurance.
Yeah, no, that makes total sense. So folks, pop your questions into the Q&A. Since you brought up this issue of equity, and I think obviously it needs to be addressed in everything we do. Has there been much thought to a program that would expand the collaboration beyond parents? One thing I thought of, it's like, I wouldn't dream of coaching my own kid's team because of the weird dynamic. And there are lots of kids out there for whom the best person to give them guidance on driving may not be a parent. How would that work?
Yeah, it would, anyone can learn the tools of motivational interviewing. And it's not really a very big leap to kind of address what some of the topics are that need to be addressed. So I think it's a really widely applicable intervention. I think one of the things that's a concern about teen driving, and teen driving crashes were going down and now they're going up. And what we see, especially because driver's education has been privatized in many states. And one of the things we see is there's a market just for safety and parents that are really concerned about high quality in driver's ed. There are also a number of programs that will try to fit it between football and basketball season. And so their main selling point is efficiency. So it's minimal core elements. So, I think we kind of need a culture shift to recognize the importance of learning to drive before we get a lot of people opting to take their time to do that. I would like to see that happen, but.
No, that's a very fair point. So we have a question from Laurel Kinsel, who's on the EOH faculty here. Says, thank you very much for an interesting presentation. I appreciated how you discussed the development of the young brain and challenges posed to safety and injury prevention strategies targeting teens. Based on your research and experience, what are some strategies for young workers? Perhaps supporting supervisors and teens to prepare them for being part of the workforce, being safe at work. Our research in Oregon shows young workers have a higher rate of injury, which is seen nationally.
Yes, and so, one of my collaborators in the workplace wellness arena, her name's Diane Rollman. She was in Oregon before she joined us in Iowa. Some of you may know her. And so she's done a lot of work focused on young workers. And I think there are so many issues. I think some of them are structural, and young workers are often put in the most dangerous jobs and the most dangerous shifts and tasks on those jobs. And we just have to decide as a policy that that's not how we're going to introduce young workers to the job setting. But I think that, I haven't given a lot of thought, but I think motivational interviewing, sort of that notion of messaging matters, is important in so many different areas. And certainly onboarding new workers, creating a culture. One thing I like about motivational interviewing is it just builds the safety culture. So I think that, again, it shouldn't be on the teen to create a safe work environment. So I think that, bringing employers into this space would be good. But, employers, especially in a lot of the businesses where teens work, they are stressed and they are dealing with so many different elements of their business or workplace. So ultimately, in the big picture, so much of what would be the biggest contribution goes back to some of the big federal policies about work flexibility, living wages, workplace safety, occupational safety and health. And we're certainly not at ground zero, but
right.
A lot of that would be really helpful. But there's also on-site programming that I think would be really helpful.
Right. And in Iowa and in Oregon and in lots of places in California, you have the interesting dynamic of the family being the business.
Yeah.
in rural settings.
Mhm.
And that's got to create a different dynamic that you may have looked into. I don't know if that's come up or not.
Yeah, well, yes, definitely. And a lot of work going on about, sort of safe farm practices for what are the right appropriate tasks for teens, what's the right kind of equipment, and at what age. So I think that neurodevelopment has actually also been really helpful for things like ATV. And there's good guidance that you can find in some emergency departments, but not in industry, about kind of how to size and age a driver of an ATV, and terrain choice as well. But it's hard to find it, even if you are safety conscious, and it's still hard to find that information.
Marie, did you have a question?
So I was curious, when you work with teens and you work with parents, are they equally receptive, or is it easier to work with parents than teens? Or I just wondered.
That's a good question. And I would say there is a huge breadth in both parents and teens about how easy they are to work with. And sometimes that's concordant, and sometimes it's discordant. And it's concordant both in the teen and the parent is easy to work with, and sometimes the teen and the parent are both not easy to work with. So I think what would be nice to come from that are some sort of magic nuggets in how to work with both groups. And so we have found that in this particular study, we didn't want the teen around when we were working with the parent. There are other studies in driving that are more focused on things like hazard anticipation. How do you scan the environment, that are really skill based on really how do you visualize driving, that have been more effective when the teen and the parent are together and kind of getting on the same page. So I think the answer is really to choose your protocol and your implementation based on the specifics of best learning practices.
Good, thanks.
And I had one last question that's somewhat professional, somewhat personal. I found it fascinating, but not super surprising, that the teens' perception and what the parents said they said were at odds. It's kind of amusing to all of us. Have you done the sub-analysis that looks at what it in dyads where there was congruence versus lack of congruence? Is there anything about the parent or the teen or the dyad that predicts congruence of messages and perception?
There is. And so we looked, for example, at communication patterns, and very sort of hierarchical communication patterns tend to have a lot of discordance, but also too, it's called the laissez-faire communication style also, that there's not enough authority in the relationship that the parent really, the teen feels like, okay, I really have to listen. So there were definitely some patterns by communication style. Yeah.
A lot to unpack there. Thanks for helping us unpack it.
My pleasure.
And for addressing
Probably not
something.
a topic that a lot of people have thought is a huge area of epidemiology.
Well, thanks once again for joining us, and thanks to those of you who made time this afternoon to join us. We're right at our time. So thanks once again. All the best to you in your new role as Chancellor for Research. And thanks again.
Thanks.
Thanks, Corey. Thanks very much.